What if I told you that ejaculating more often could actually help lower your risk of prostate cancer? Don't just take my word for it. Let's take a closer look at the science behind this. I'm Dr. Rena, a urologist and pelvic surgeon, and if you enjoy this kind of content, be sure to subscribe and tap the notification bell so you never miss any of my upcoming videos. So, why is this even important? Well, prostate cancer impacts about 1 in 8 men over the course of their lives. That's a significant number. But what does ejaculation have to do with prostate cancer? For those who may not know, the prostate's main job is to produce fluid released during ejaculation, which helps nourish and protect sperm. That fluid tends to build up in the prostate between ejaculations. There are several theories about how ejaculation might be linked to prostate cancer, or how too little ejaculation could play a role. The leading explanation is known as the prostate stagnation hypothesis. This suggests that if the fluid isn't regularly released, it can accumulate substances that may promote cancer, potentially increasing the risk over time. Other theories suggest that more frequent ejaculation may help reduce psychological stress, which has also been associated with cancer risk. Another idea is that maintaining regular ejaculation supports a healthy prostate microbiome and helps prostate cells function properly, particularly in how they manage zinc and citrate metabolism, which are believed to play a role in helping prevent prostate cancer. So, when you look at it overall, there are clear reasons why researchers found this to be an important and interesting question to explore. But how did they actually go about studying it? There are a couple of key points here. This research was based on a large survey involving more than 40,000 men starting in 1992, and these participants were followed all the way through 2010. Why does that matter? Because prostate cancer develops very slowly, which means you need to track people for over a decade to truly understand whether something from years earlier had an impact on their cancer risk. In this study, the men were asked to answer a variety of questions, including one about how many times, on average, they ejaculated per month during specific 10-year periods of their lives. These time frames included ages 20 to 29, 40 to 49, and so on. Participants had to reflect back and estimate how often they ejaculated during those years. They also completed surveys every couple of years and were asked about other factors such as physical activity, body weight, smoking history, diet, including processed meats, tomato-based foods, and alpha-linoleic acid, along with multivitamin use and major life stressors like divorce. Researchers accounted for all of these variables in their final analysis to see whether ejaculation frequency was truly linked to a lower risk of prostate cancer. One interesting observation from the study was that it also revealed patterns of ejaculation frequency across different stages of life in this large group of men, showing clearly that frequency tended to decline as men got older. So when researchers looked at men who reported ejaculating at least 13 times per month during their 20s, about 57% said they reached that number. But by the time those same men were in their 40s, that number dropped to around 32%. When they analyzed all the data, they grouped the participants into different categories. Very few men reported ejaculating only 0 to 3 times per month, so that group wasn't used for comparison. Instead, they compared men who ejaculated 21 times or more per month with those who reported 4 to 7 times monthly. And just to put that into perspective, 21 times a month is quite frequent. That's about 5 or more times a week, which is a significant amount. By the time researchers reviewed the results, the men were, on average, about 59 years old. They found that men who ejaculated 21 times or more per month during their 20s and 40s had about a 20% lower chance of being diagnosed with low-risk prostate cancer compared to those who ejaculated 4 to 7 times per month. However, this pattern did not apply to high-risk or more aggressive prostate cancers that had spread. The reduction was specifically seen in lower-risk cases. The reason I'm bringing up this study is that although it was originally published in 2016, I started noticing news articles discussing it again just a couple of weeks ago. And most of those headlines simplified the message down to one idea: ejaculate more often. So, is that really what you should do? Well, I think it's important to look at studies like this with a critical eye. This was a very well-conducted study. They followed participants over many years, had a strong team of researchers and statisticians, and adjusted for a wide range of factors that could also influence prostate cancer risk. But think about it for a moment. Men who are ejaculating 21 times or more each month may be quite different from those who report 4 to 7 times. They might be more physically active, in better overall shape, or more likely to be sexually active, which could also play a role. So the real question becomes, should you increase how often you ejaculate based on this study alone? In my view, even though this research is solid and accounts for factors like activity level, stress, diet, and potential carcinogens, it still doesn't clearly prove that every man should aim for 21 times per month to prevent prostate cancer. It's an interesting and important topic, but not a strict recommendation. That said, if you already have a higher frequency, there's no reason to think that's harmful. You can continue as you are. And if you've been holding back out of concern that it might be unhealthy, the evidence suggests that it likely isn't. But should you push yourself to that level at the expense of your daily life, relationships, or overall well-being? Probably not. I hope you found this discussion helpful. I certainly found it fascinating and wanted to share it with you. Thanks so much for watching, and as always, take good care of yourself. You deserve it.